Life's a gamble. Little is certain. So much is chance. But no big deal, eh? Well, maybe it's more of a big deal than we have recognized up to now. In all parts of the world, regardless of culture, religion, or age, gambling has been taking place for thousands of years. Many people believe there's nothing particularly wrong with gambling in itself, no more than there is harm in the odd glass of beer or wine. But as we know, for some people, substance abuse can cause untold ruin and disaster. We're beginning to realize that it's the same with gambling. In response to the Social Planning Advisory Committee, the John Howard Society of Nanaimo, with the support of the Nanaimo Alcohol and Drug Addiction Committee, recognized the addiction concerns of gamblers. Together, the groundbreaking Problem Gambling Awareness Program was developed. Led by John Howard Society Executive Director Anthony White and Program Coordinator Karen Shaflake, a campaign to make Nanaimo more aware of the problem gambling issue was instituted.
The Problem Gambling Awareness Project is significant in that it's the only one of its kind in Canada at this time that is municipally funded. It consists primarily of 4 program modules, one being data collection, whereby we are monitoring and engaging the impact of problem gambling. The sensitivity training is for counselors and other professionals in the community wishing to enhance their current skills, specifically around problem gambling. Outreach services are for people wanting counseling or a referral elsewhere. And education and prevention is for community groups and the general public who would like to have a talk or some other kind of information on problem gambling.
A community program of education and awareness was initiated in January of 2001. This involved the media, schools, presentations and resources to community groups and organizations. A gambling module was added to the Think First school crime prevention program. Sensitivity training was subcontracted to Shore Counseling Services and facilitated at the Salvation Army to local counselors. Outreach services were established and overseen by Program Coordinator Karen Shaflake. Think First training in schools was the mandate of John Howard staff, Tony Dwyer and Alyssa Gray. In April 2001, a program of research was initiated in conjunction with 22 community agencies and support groups. An outreach telephone link was established and monitored to assist in data collection. The collection of data was ongoing, and the various agencies involved worked together at an unprecedented level of joint commitment with the John Howard Society. Individual agency reports brought the issue of problem gambling into focus.
Isn't it a wonderful thought to think that you can go and drop a little bit of money and win a whole bunch, but we know that it doesn't work that way 99.99 times out of 100. But it's those people who are avoiding their own life situations and home situations that are there to escape their relationships that are in the bingo halls. Yes, maybe they can't afford to lose it, but like another woman said, until the crisis hits, until there is a divorce, until there's a bankruptcy, until the home and the boat are on the line, then is when you see them and they're acknowledging the gambling problem.
The depth of the problem, people are experiencing relational breakup, not just an inconvenience. It's really reached devastating proportions.
Most people come into the office because of a crisis that's recently happened in their life. They've just blown their last paycheck, they're having relationship problems, they're dealing with work problems, and their life is falling around, crumbling around them. After a period of time, a person starts to chase their losses, and they become addicted to the rush and the excitement of the gambling and the hope of the big win. And if they can just have one win, then that will solve all of the problems, and they won't have to disclose the amount of gambling that they've been doing. They'll be able to pay off debts, etc.
Research undertaken for the city of Nanaimo in 2000 estimated that there were about 2,500 local adults and youth with problems of gambling. A further 17,500 family members, friends, relatives, and colleagues of these problem gamblers experience negative effects, bringing the total in our relatively small community to over 20,000 people negatively affected by this critical issue. Service professionals believe that the figures could now be higher. A public education toolkit has circulated in the Nanaimo community since the winter of 2001. Aimed at all age and cultural groups, it contains a variety of informational and resource materials that have already made an impact on our community. How do we recognize a problem gambler? How can we know who is afflicted with this compulsion? Quite simply, it is when gambling negatively affects health, relationships, finances, school, or jobs. A neighbor, a co-worker, a family member, a child, a grandparent, the person at the corner store, the executive of a large business. Anyone can be caught in the web that problem gambling casts for the unwary. The problem may seem invisible. The facts are not. 30% of problem or compulsive gamblers also have problems with use of drugs or alcohol. 66% of problem or compulsive gamblers have committed at least one crime to pay their gambling debts or maintain their habit. Children of problem or compulsive gamblers are twice as likely to commit suicide, drop grades, and abuse substances. Up to 36% will eventually lose their jobs as a result of their behavior, not to mention their self-esteem.
The first time I went into the casino, I had 75 cents in my pocket, and I dropped it into the first machine, and I won triple sevens all the way across. It brought me back about $2,000, and that was the start of it.
You know, from living with somebody in recovery, my husband's told me it's a compulsion. It's, you know, you go to bed at night and you hear the bingo numbers, or you hear the bells on the slot machines in your dreams, and I don't think people realize how big of a thing it is. Oh, it's just, you know, it's only $20. Oh, it's here, oh, it's there. But I think that when you're living with somebody, if you know them well enough, and you've got that feeling in the pit of your stomach that something's not right, I think you need to listen to your gut instinct.
I think secrets is one of the big flags in my family, that the more people are hiding from each other where they were or how much they spent, tells me right away that there's a problem. I'll hear, you know, one story from an uncle and a total different story from a cousin about who spent what and won how much and how long they were there. So to me, that's a real big sign when people start feeling like they need to lie about what they've been doing. And so it affects my children specifically by, you know, my dad will show up at the house with lottery tickets just as a treat for the kids, scratch and wins, and I have to intercede and take them away, and it makes a, you know, uncomfortable situation. Yeah, there is help out there through the John Howard Society and Gamblers Anonymous. There's always, I think, help if somebody's willing to make a change and they're serious enough, they'll find the help that they need.
Nanaimo now has detailed data on the extent of the gambling problems in our community, thanks to an ongoing database supported by local agencies and the city of Nanaimo.
The biggest thing to help yourself to crawl out of a gambling addiction is to admit to yourself, first and foremost, and to those around you that you love and care about, that you have a gambling addiction, that you are a problem gambler, and that's the best way. Being honest and open with yourself is the best way.
Well, we got involved in this project because some of our clients have gambling problems, but more so because it's a community health problem, and our agency, the John Howard Society, is involved in the health of our community. If you took the analogy of a high-rise apartment building, say 10 stories high, The alcohol and drug problem can sometimes be out of control on the 8th floor. Very difficult to reach, very difficult to manage. The gambling problem is perhaps only on the 2nd floor, and it's reachable. With the assistance of the City of Nanaimo and all of the stakeholders, this project has been able to develop the tools that will allow us to do something about the problem. Through education and through interventions, we can do something about problem gambling in this city. Really the choice is up to us.